what I want to talk about this morning is really why do we need to think about reimagining child welfare, and then how can we do that? So the intention is to try and be a little bit provocative this morning, and to look at some of the issues that we face within children's social care, and about how we can go about actually doing things differently. Information that came out from the Local Government Association was saying that there is a contact to a children's services somewhere in England every 4.8 seconds. The number of referrals that are coming into children's services have gone up 19% between 2008 and 2020. Section 47, so child protection investigations, have gone up by 162% in the same period. That means that 1 in 16 children are the subject of a Section 47 investigation before their 5th birthday. And the number of children with a child protection plan is up by 76%. And the number of children looked after is increased by 34%. So clearly an absolutely incredible rise and activity that most of us, I think, will be very aware of. But actually, we know some of the things that are driving this increase, because actually, if you are a family living in poverty, you are 10 times more likely to be subject to statutory intervention than if you're a child that is simply living at home. That cannot be right. We cannot be saying that poor parents are 10 times worse. It's got to be, hasn't it, that actually the pressures that are on those parents, are more significantly greater. But by the same time, we've also got the inverse care law, where actually if you are poor in a more affluent area, you're even more likely to have a statutory intervention in your life. And if we think about poverty and the impact of poverty, we now have 1 in 3 children living in poverty in the UK, and that's going to increase by at least 200,000 once the universal credit uplift comes into force, whether you work another 2 hours or not. And the number of people, this is from the Trussell Trust, receiving a 3-day food parcel increased 9,797% between 2008 and 2021. So if from children's services is just what you need to make your day. And actually, we know that once kids become involved in service, the service that they get is not always what we would want to offer them. So at 3 or more home moves in a year. 1 in 5 care leavers is homeless within 2 years of leaving care. 1 in 2 care leavers are not in education and employment. If you look at those outcomes, if you look at that pressure, it's no surprise to find that 1 in 6 social work posts are vacant. Ooh. The other thing I think that drives the increase is how we think, or how we have become conditioned to think about families and risk. That families are risky and dangerous, yeah, and therefore the best thing we can do is get kids away from them as soon as possible. And we can see that, I think, in some of the language that is around families. So we will talk about problem families rather than families facing problems. Yeah, we start with deficits. We start looking at risks rather than looking at the strengths that actually can reduce those risks and building on those strengths. We look at the individual and what's happening with that individual and whether that individual, yeah, is delivering the kind of parenting that we would want or expect, rather than looking at the context in which those parents are parenting. I have never experienced the shame or the pressure of never having enough food, yeah, with that. And we need to think, you know, very much about what are we doing and why we're doing it. I mean that both as and yeah, and authorities. Are we focused, yeah, on process, yeah, rather than using relationships? Yeah, a good process is helpful, yeah, but it's the relationship that we are able to establish with parents, carers, children and young people that make the difference. And the 9-10 rule. So, and I'll come back to that in a second. So what I want to do now is just look at some thoughts and ideas about how we might reimagine it, because it all sounds pretty desperate. We need to remember, yeah, that the majority of children become looked after because of the behavior of adults. Yeah, right. It is issues affecting parenting and parenting capacity, yeah, that make families struggle. Only 10% of referrals coming in to children's services actually involve significant abuse. The majority are parents struggling with problems and challenges, domestic violence, alcohol, substance misuse, yeah, mental health issues. Yeah, many of those worsened, yeah, by poverty. That families are the most underutilized resource that we've got. Yeah, because of the way that we've approached families, because of the way that we've been very process driven, because of the fact that we've been very risk averse, we've tended not to look, yeah, at families. And by family, yeah, I mean however, yeah, you or the family decide to define that. So that may be, yeah, just blood relations, or it may be, yeah, people that are considered to be, yeah, close friends who become almost family members. And services are more effective if we can involve service users, yeah, and staff, particularly frontline staff, in the development of those services. And really, yeah, whatever we're doing, yeah, relationships need to be, yeah, at the heart of what we're doing. We need to think and recognize that families may have, you know, don't want to be too controversial, but they may have some advantages over the state when it comes to parenting. They've got a little bit more staying power. Yeah, family involvement. Yeah, no matter how my mum might have wanted it, didn't end when I was 18, 21, 25, or actually 55. Yeah, families there, they have staying power. They understand the child's history, yeah, and circumstances. They've got an understanding of family strengths and challenges. There are relationships, Yeah, and sometimes those relationships are damaged, and therefore our role within children's services is to help to repair those relationships. Yeah, so the family can function, yeah, optimally. And a key thing that families have, most of them, yeah, is love. There's also something about the environment in which we in children's social care, yeah, operate. And the first thing about that is that our understanding of childhood and child welfare, so what's acceptable and unacceptable, isn't static. It changes over time, but sometimes it can change quite quickly, as we've seen. If you have a major child protection crisis, yeah, within either an authority or nationally, then suddenly views of what is and isn't acceptable parenting, yeah, changes quite quickly. Unlike many professions that our partners work in, we don't work in an area that's got clearly defined boundaries. And by that, I mean, yeah, if you look at the police, you either break the law or don't break the law. They have some flexibility in how they deal with you, but you've either broken the law or not broken the law. You are either, whoops, sorry, apologies. You're either healthy, yeah, or not healthy. With us, we're looking at, yeah, is parenting good enough? Yeah, and that's not defined. There is nothing that says what good enough parenting is. So we're involved in making both legal and moral judgments. And much of the work that we do in children's social care, if you think about it, when you qualify, they should give you a crystal ball, because what we're doing is trying to predict what will happen in the future. Even if we know very clearly that a child has suffered significant harm, and that harm as a result, yeah, of the parenting that a child received, yeah, or didn't receive. The question then is, if we put this intervention, if we intervene in this particular way, is it likely to happen again in the future? Yeah, and we don't know. We hope. So what we're involved in, and where we sometimes get stuck, is that we try and be certain all the time. And it's actually not about coming up with the right answer. It's about coming up with the answer that's least likely to be wrong. So even where there are very clear circumstances that says, yes, these parents, yeah, did cause significant harm to the child, there is no prospect of that changing. Yeah, there is nobody within the extended family who can offer to care for the child. This is a very young child. The best thing for them is adoption. We don't know how that will turn out. We just hope it will be better. And partly because of pressures and the processes that sometimes can drive us in children's social care, we end up dealing in the moment. So making a decision about particular circumstances that a child is in now and that a family is in now, yeah, without thinking what are the long-term consequences sometimes of the decisions that we take. Hopefully this will be familiar to most of us, and it's that, you know, any child, yeah, has the context of their parent carer, their wider family, yeah, and community around them. But in thinking about family value and thinking about how we can rethink about child welfare, we've also got to see the practitioner, yeah, in context. Yeah, that the arrangements around the practitioner have an absolutely profound impact on the way that we practice. So the structure, the way in which cases move through the organisation, the way in which we approach decision making and quality assurance will influence how you practice. And an example of that from my own experience is that back in the 1880s, I was a team manager in a large London authority that had experienced two quite tragic child deaths, and therefore the organisation response to that was that any referral which in any way talked about child protection, because we talked about child protection back in those days, would be responded to by a joint visit by Children's Services and the police, even where I, as the team manager, and the police officer would know that it was a waste of time. It was inappropriate for us to be responding in that way. That was the organisational response. Now, actually, I'm a very nice man. I'm a nice guy. I come into social work to help people. That's what I wanted to do. I was there for nearly 18 months, and I look back at it and I think, what was I doing? Why did I do? The systems and the structures around me pushed me in that direction. And before I knew it, I was out there telling people, I know it's a bit of a waste of time, but go out and do it. Because that's what we need to do. It had no benefit for children and families, quite the opposite. Quite the opposite. I once, because we couldn't get enough practitioners to deal with the number of child protection investigations, in inverted commas, we were dealing with, actually had to go out with a police officer, and we did a visit, very nicely to a mum who'd got in a flat on the 13th floor of a block of flats. And actually, it had been referred in by I think she was having a dispute with and this will tell you how long ago it was. At the end of the visit, I said to Mum, look, I'm on the nursery panel for the local authority that allocates places. I could get you a place definitely for the older of your children, and probably the second oldest. And she said, no, thank you. I said, no, look, you wouldn't have to do anything. I'm on the panel, wink, wink. I'll fill the forms in when I get back and sort it out. She said, no, thank you. I said, can I ask why? And she said, yes, you came out here to catch me out, and you haven't caught me out. You want my kids to go there so you can catch me out. You're not going to catch me out. So what we've done by the approach that we took is actually, move that parent further away from services that would have helped her. But if we're going to rebalance and change the way in which we approach child welfare, we need to have some kind of framework around that. Because good outcomes are dependent on good partnerships and good practice. As we said, it is issues that affect parenting capacity, that lead the majority of children to become looked after. So children's social care are not going to be able to deal with that on our own. We need good, strong partnerships that will support good practice. And good practice and good foundation, that we really need strong foundations, which means that actually, we need good principles and values to underpin our approach to work. But actually, if we look and go back to the Children Act 1989, we have a value and principled piece of legislation. The Act's universal. It applies to all children and young people equally. The first thing it says is the welfare of the child is paramount, so the child's at the centre. The wishes and feelings of children are also central, so we need to be thinking about what the child's wishes and feelings are. We got to understand the impact and consequences of interventions, because the Act has a no order principle. So even if we get to court, if the court determines it would be better not to have an order, they can make no order. You don't necessarily get, as we know, the order that you asked for. The intervention that we used must be the least intrusive possible and provided at the earliest possible opportunity. So there is that about early help. It talks about family all the way through the legislation. And it talks, yes, about significant harm, but also, significant harm, section 47, but before that, section 17 talks about need. If we meet the need, we can prevent the harm. So around that framework, within that framework, how do we work? And I think it's not complicated stuff. We go back to the beginning, which is social work is essentially about relationships. Right, first and foremost with service users, but also, with social work colleagues, the people we work with in teams, colleagues from other professional backgrounds, health, education, police, to name a few, with organizational context and the wider policy context of practice, and finally with ourselves. But these relationships don't exist in isolation from each other. They're interrelated and exert influences on each other. And so we looked to relational practice. How do we support? How do we help to create and maintain healthy relationships? And what we've got there on the, I hope it's the same for you, the right hand side, is the social discipline window, which says basically we all like it more, if people work with us rather than doing things to us or for us or not at all. That actually that is best. It helps us to get the best outcomes. And going alongside that, we need to provide both challenge, and support. So if we've got loads of challenge but no support, we're doing two. That's where you get your child protection plan that's got 31 items, for the parents to do, but nothing for us as professionals. But if it's all support and no challenge, then we're just doing four. Where we want to get to is the with box. And the thing about relational practice is that it is strengths-based, it's value-driven, it's about building, maintaining and restoring relationships. And sometimes those relationships that we have with one another, with partners, sometimes within families are a bit fractured, not working very well. Actually, how do we get those working effectively? Importantly, it's not a model. This is not an off-the-shelf model where you do it in the same way everywhere. The values and the principles, and the outcomes may be the same, but actually it will be slightly different depending on the organizational context, and the environment in which we're working with. So it's not a model or a tool. It is, this is how we behave and act. And it, as I said, it involves both high support and high challenge at every level. So in putting it into place, it really isn't rocket science in our experience. It's about a shared language and values, shared vision, and outcomes. It's about creating a shared culture. It's creating the conditions, for success. And those are going to be most effective, when we are looking, in a value-driven way at the outcomes that we are trying to achieve for children. And everybody is working together, to achieve those. That's where you have your best opportunity to do best practice. It's a shared approach and way of working. It's got children at the heart of regeneration. I'll say that something about that. And it's also very much about holding our nerve. For leaders, it's about holding our nerve that things will improve, yeah, and get better. For practitioners, yeah, one of the key things that we find ourselves doing in children's social care, yeah, is managing risk, yeah, and accepting that that's part of our job, is to hold and manage risk. So some key guides about doing it. First is, let's keep it simple. Yeah, we set ourselves one question when we set off on the family value journey in Leeds, which was quite simply, what's it like to be a child growing up in Leeds? Yeah, and then how collectively do we make it better? And it understood that actually children do not live in cities or local authorities. They actually live in families and communities. And therefore, we need to have an understanding of the environment in which children are living, yeah, an understanding of those communities, yeah, and be able to respond locally to those needs. So the first thing I think that is absolutely key, and I'm coming towards the end, so people will be really pleased about that. Rumours of a 7-hour presentation were greatly exaggerated. But to be successful as an authority, you have to be successful for children. If anybody, as I did, has moved with a family from one place to another, before you move, you're looking at, is this going to be a good area, yeah, to bring my children? Is it safe? Are there things to do? Is it a good environment? Are there good schools? Yeah, if it isn't, you're not moving there. Yeah, or you're moving there on your own. But also, in terms of thinking about how you are successful as a local authority, if you want to attract businesses into the authority, are schools producing children who have the social skills, yeah, and the qualifications that your business needs? Yeah, because if you're not, there are loads of other authorities who will be. So children, as I just said, don't live in cities or local authorities, they live in families and communities. So what we need, you know, we found in Leeds, the first thing was establishing a vision for all children that everybody can buy into and actually signs up to. And that should have a focus on both outcome and entitlement. Yeah, children have a right to expect, yeah, good outcomes. That's not optional, yeah, and that's not something that is just on children's social care. That is something that's on everybody within that authority to ensure that children have the opportunity to reach the potential, irrespective of their needs and circumstances. Having that kind of vision and that kind of sign up makes children and young people visible. Having made them visible, yeah, we need to provide them with voice and influence. One thing that we're very good at, yeah, in the organizations that we all work in, is asking children what they think, whether that's on an individual basis or collectively, and then ignoring it, yeah, if it doesn't fit in with our view, or we feel that we don't consider it to be a priority. It enables us to build relationships with all the sector, including businesses and voluntary sector agencies. And what we looked to do in terms of using those relationships was to build a network of ambassadors that actually supported children's social care to provide more effective support for those children who are most at risk of not being able to reach the potential. So we had a lot of support in providing venues and support for awards and meetings and groups. And sometimes those were groups of children, they weren't professional groups. In developing fostering friendly employment policies within all agencies and organisations in the city, and providing employment and apprentice opportunities, particularly for our care leaving group. And finally, in terms of thinking about where we want to get to and how we want to be, is practice and leadership is underpinned by an understanding of and commitment to relationships. Yep, so that we are creating an environment that enables us to have healthy relationships that enable us to support and challenge, and that's a two-way process. Some of you will have worked out that as director and assistant director, they kept me as far away from children and families as I possibly could be kept. It was not my job to deliver good outcomes for children. That was the practitioners across children and families that work with them every day. But my job was to provide an environment in which they could do best practice. And that meant that they had a manageable caseload, that they had good quality supervision from a stable team manager in every sense of the word, that they had an IT system that worked, that they had a good working environment, and that they had good training and development opportunities and the opportunity to develop the social work career in Leeds. If I was providing all of that, I had a right to challenge that we would have better outcomes than when none of those things were there. That our focus is on delivering good outcomes for children rather than simply on process. And we find ourselves in Leeds that we got lots of process that we were very pleased with, but actually did not significantly improve the lives of children in the city. That families and the issues that they place are viewed within their wider social and community context, and there's an understanding of how that context can affect the parenting role. It was very interesting that during lockdown, and I talk personally, there was considerable concern about alcohol consumption, and about how much people were drinking at home. Why was that? It's because we felt stuck. We were stuck. We were being deprived of meaningful contact with colleagues and friends and family. But actually, part of the issue was we'd no idea how long we were going to be stuck in that position. If you're parenting in poverty, and you cannot see a way out, how does that feel? So we need to understand the context and how that can impact on parents. That we're all committed to working with families. And that our relationships with families, the way we approach children and families, are authentic, respectful, resourceful, reliable, accessible, flexible, truthful, empathetic, underpinned by a genuine interest, responsive in thoughtful ways, and this is evidenced both in our interactions with families, the way that we talk with and about them, and the way in which we record. And that practice and leaders have positive relationships with local communities. And in talking about those relationships with children and families and that list, I'd also say that the relationship that leaders have with frontline practitioners, should be exactly the same. And that where they're not, we should be in an environment, where we are able, to challenge that. So, look at that, almost right on time. We invite you now to go into the breakup rooms and to consider 3 questions.